Yeah, right, that's us. Should be going live. Perfect, okay. So good morning, everyone. Thank you so much if you're joining us live or if you're watching this on demand. We're having a session today for cardiovascular sciences and diabetes, postgraduate students looking to start this year. And as you can see, we've got some academics with us to answer your questions. Very exciting. If you submitted questions as you registered, then I've got those here, but we are here for you to answer questions for the next, 30 minutes. I think we might need to jump out. Some people might need to jump out at 11, but we'll be here at least for the next 30 minutes. And if you have questions, then please don't hesitate to drop them in the Q&A box at the bottom of your screen. I'm going to start off by doing some introductions. So my name's Sarah and I work in the graduate school. I'm just here to act as a host and to field all the difficult questions to the academics. But I'm also the person who emailed you the invitation to the webinar. So if any questions come up and you can't figure out who to send it to after the time, you can always email me and I will be able to pass it on to the right person. Anyway, let's get started with some introductions then. So if I could ask Dr. Dilys Freeman to maybe do a little intro and say hi.
Hi, I'm Dilys Freeman and I'm based in the Institute of Cardiovascular and Medical Sciences. So I have a job as a researcher as well, and I'm interested in adipose tissue function in insulin resistance and type 2 diabetes, and also in metabolism in pregnancy and its complications. So I'm the program director of the MSc Diabetes, and I'm the person that runs and organises the course, and probably as it would be the main point of contact that you would have during your time at on the diabetes program. So I would first meet you at the induction event, and then throughout the course, I'm keeping an eye on all the students academically and also pastorally. Just hope that everybody's getting on okay. Okay.
Lovely, thank you so much, Dilys. Professor Eleanor Davies.
Hi everyone, I'm, as Sarah says, Professor Eleanor Davies. I'm one of the directors of the MSc Cardiovascular Sciences course, and I work in the Institute of Cardiovascular and Medical Sciences. I have a dual role in there. I work as a educator, like on this programme, and I also have a research group. And my main interest is looking at hypertension and cardiovascular disease. And really I'm interested in cardiovascular endocrinology. So I'm interested in the role of hormones in regulation of blood pressure and the cardiovascular system. Now, as I said, I'm co-director of this course, and it will be me or my colleague, who you'll be introduced to in the next couple of minutes, who will oversee the running and the academic content of our course. And I'm looking forward to seeing you all at the induction day and welcoming you all to the programme.
Perfect, thank you very much. Professor Paddy Mark.
Hi, I'm Paddy Mark. So I am co-director of the MSc Cardiovascular Sciences along with Professor Davies. And at my job, so I'm also based in the same Institute of Cardiovascular Medical Sciences. I also work clinically as a nephrologist, and my main research interest is in the link between kidney dysfunction and cardiovascular disease, such as hypertension and cardiac abnormalities. Like Eleanor, I'm co-director of the course, so I look forward to meeting you, whether that's in person or virtually. I think there's a lot of things that have changed about the world over the last year, so but I look forward to hearing more about your interests about the course.
Perfect, thank you. And Lindsay, if you wouldn't mind doing a wee intro as well.
Hi, I'm Lindsay Ross. I'm the postgrad administrator for both Masters of Diabetes and Cardiovascular Sciences. Out with obviously the academics, I'll be your first point of contact as well with any queries, obviously from enrolment to graduation. Yeah.
Perfect, thank you. I'm just pasting There we go. So in the chat box now, you should see an email address for both diabetes and cardiovascular sciences, and those will both go to Lindsay. Generally speaking, if she doesn't know the answer to a question, which is highly unlikely, then she will know the person to forward you on to. So you're in safe hands there. If you've got questions, then you can get in touch with her. But like I said, if you have any issues with seeing the email addresses there, then you can contact me. Or you can also go to the program webpage on the University of Glasgow website, and right at the top of each of the program web pages, there's a blue box which has got like a academic contact email address in it, which is the same one that I've just sent you there, so you can access it there as well. Okay, I think that's all of the housekeeping bits for getting started. So we're now going to work through your questions. And as has already been alluded to, it's interesting times that we're living in. We're going to do our best to answer your questions with the most up-to-date information that we have right this second. However, as you'll be aware, if you're based in the UK or somewhere else in the world, the guidance on this is changing pretty much constantly. So if you're watching this even on demand and you're unsure about any of the things that we mentioned, then please do just send us an email and we're happy to chat to you. And I think I could hopefully speak for everyone here as well to say that, you know, we are happy to receive your emails. We're happy to have a call if that's better. We're here to support you in any way that we can, especially given the situation. So let's start with, we had a couple of questions which were from cardiovascular science students, which were about, actually we'll start with this one. Are there any materials or reading that I can get started with to prepare for the start of the course? Which was for CVS, but I think we'll also maybe ask that of diabetes as well in a second. But who would like to take that one? Eleanor, Paddy?
So I'll start. Normally we don't send out reading material during the summer before the course starts. You will receive lots of reading material, current papers, you know, articles that you need to read from each lecturer on the course. However, if you wish to look, you know, at some cardiovascular papers, research articles, you know, I would suggest some good reviews on the cardiovascular system, the vascular biology of the cardiovascular system. You could do a recent review on, you know, heart failure, for example. There are lots of stuff you could look up, but we don't have a prescribed reading list for the summer before your course, mainly because, as I say, lecturers update their lectures, they keep them current. They will give you the most up-to-date articles that you may wish to look at, and we'll provide those and upload them onto the Moodle site when we do the lecture. Paddy?
Perfect.
Usual Zoom fail, accidentally muted myself. Yeah, I'd agree. I'd add to that there's a couple of other reasons why. So you know, do I have loads of papers ready for people to have, either based on things I want to teach or based on things my colleagues wish to teach? Yes. There are issues because most of what we do, it's all about, it's a science course. So what we do is not really taught from textbooks, but it's taught from you know, scientific findings, journal articles, peer-reviewed journals, and things like that. And as soon as you're matriculated, it's absolutely fine for us to circulate that stuff for teaching material. It's generally not fine to circulate that material to people who aren't students attached to you. So the minute you're matriculated, we can start to forward that on. But publishers and researchers sometimes feel uncomfortable with their material being under copyright issues for circulating material before you've actually been ticked the box that you're one of our students. So as soon as you're matriculated, stuff, I've got 4 papers lined up if anyone wants to read it to get started. But that's another part of the reason. The teaching comes from journal articles rather than textbooks. So that's why I'm a bit uneasy about sharing stuff beforehand. But as soon as you're good to go, we've got plenty of stuff to share. Is that fair enough, Eleanor?
Yeah.
Okay. And I guess on the same question to Dilys, have you got anything to add for your?
I would just reiterate what Paddy said. So yes, we do have reading lists. We do have a list of key reviews which are recommended to read before each lecture, but the difficulty is that these are predominantly journal articles, and in order to get access to a journal article you need a subscription, and the way that works is when you're a student, the university has a subscription. So once you're a member of the university, you have access via the library to all these journals. You'll just find it too difficult ahead of time to access these papers. So there's really no point in giving you reading lists.
Okay. And on a similar note, we also had a question which was about, will research papers and reading material also be available online if we don't have access to the library in person?
I can take that one. Yeah, so once you are, it follows on from what I was saying, is once you are a matriculated student, then you have a virtual access to the library as a University of Glasgow student via the University of Glasgow desktop. It recognises you as being a member of the university, and therefore you're automatically given all the permissions to the appropriate journal articles, etc., through the library.
Okay, perfect. So I suppose just before we get more into what teaching is going to look like, we also had a question which was, how do we register our student portal to access online lectures and materials? Are we already able to register now? Might be one for Lindsay, or I don't know, at what point would you be able to access things?
Are you going to answer, Lindsay, or do you want me to answer?
Either or, yeah.
You go ahead, Lindsay.
Basically, as soon as the student is enrolled onto a course, they should automatically get access to the course Moodle pages.
Mm-hmm. So I think if you're already registered, no, don't worry. If you're registered and enrolled, you should have access. If you're having issues with that, email Lindsay.
Yeah.
I think
just to explain, I don't know if the students
email myself, yeah.
The Moodle is what we call our virtual learning environment.
Yeah.
So it's basically the interface. So every course has like a web page, if you call it that, and it's an interface where you can access all your teaching materials. In this situation, we'll be doing a lot of online teaching. It's where all your Zoom class links and everything will be in there. If materials are recorded, they'll all be on that. So each course that you'll be on will have its own virtual page, and that's your point of call to get all the information and materials for that course.
Okay. And also on the topic of sort of timetabling registrations, we had a question from, it was a diabetes student saying, is the timetable for 2020-21 available, and when will it be sent to us?
So I would say the broad timetable for 2021 is available as in what days of the week each of the classes is on, but the detail of who is teaching on what day is not available yet, because we are tying down, and this is the same for all programs and courses, we're trying to tie down a lot of individuals to teach on a particular day, and that just takes a lot of time and juggling, and we don't do it too far in advance, especially in the current environment where a lot of our clinical teachers at short notice are being called to do other clinical duties. So it's probably no advantage to give you the timetable ahead of time. I would just look at the broad description of the semester 1 and semester 2 courses that are given on the course outline that you'll already have seen, and that information is fine for the moment. And as soon as you start, you will get a program handbook, and in that program handbook you will get the program structure, and then when you enroll in a course and start the course, you get the detailed list of lectures for that particular course.
Okay. And maybe the same question then for cardiovascular sciences, if you got a similar broad timetable where things are outlined but not quite scheduled into the detail yet.
So ours will be exactly the same. We will have the broad outline of the course timetable, and then the fine tuning will be done as we go along, subject to people's availability and subject to whether people are in the hospital, etc., or have other commitments. But the broad dates for each block or each module will be timetabled.
Okay.
And it's worth saying that the content of the course will be the same, and if things have to be shuffled around in lectures, that will be, you know, it's likely that most of this will be recorded lectures anyway, because that's what the platform we're all moving to. So it's not as if, oh, the people are in the hospital, so therefore that bit will be cancelled. The modules that make up the overall course are the same: clinical aspects of cardiovascular disease, the heart failure module, the imaging and cardiovascular disease module. They're all standing as is. It's just, I think we all have to be a little bit flexible with timetabling right now, and that's, say, unfortunate, but in some ways it means that the lectures, rather than being set, oh, you must turn up for a lecture on a certain day, are likely to be recorded lectures that are more of a resource, which in the past that was difficult because it meant if somebody couldn't attend a lecture because of illness or something like that, they may have missed it forever, whilst that's not going to be the case. So I think there's opportunities here as well.
Yeah, perfect. We did also have a question which was about when will you get this timetable? Perhaps someone's not received it yet. When would a student usually have access to that? Or should they already have it, in which case? Right, okay. So that might still be...
There's no advantage to having a timetable ahead of time, really.
So it will be made available, what are we now, October, so within the next few weeks, I would have thought. Yeah.
Yes.
Just confirming all teaching for semester 1, yeah.
Oh, and I can see Dilys is also put here. You will find the broad course structure in the university perspective, or also on the program webpage. That is also true, yeah. If you look on the program webpage, I think we've now got it all linked as well, so you can see details about each of the courses, both core and optional. So double check the webpage if you haven't been on it recently. There might have been updates there. Okay, now to get into the tough questions. What is teaching? What will laboratory and seminar sessions look like? How will they work? We have had a live Q&A, which is, if our batch is not big enough, will we have more face-to-face lectures? I'm assuming that's to do with numbers and social distancing. That says it's for cardiovascular sciences. So maybe if we start there with face-to-face teaching and what that might look like when we get there.
So under normal circumstances, we do face-to-face teaching, i.e. I may be in a room with all the students from the Cardiovascular Sciences course. At the moment, we are basically having face-to-face teaching, synchronous teaching, but it's done online, or asynchronous teaching where it's done online and it's recorded. So there will be a combination of both. It depends it depends a little bit on the lecturer or on what's being taught. So just now it will look something like this. So you may log in and I may go through, you know, my PowerPoint slides, or we may upload the PowerPoint slides in advance for you to look at and have a tutorial-based session whereby I might ask you some questions about the slides and the teaching that I've sent you, or you may ask me about things that I don't understand. So at the moment, things are online, they're not on campus, and we will obviously have to be reactive and flexible on, you know, what guidance and guidelines come out from the government as to what we can do next. We would like to be able to do face-to-face teaching if we can, if it's permissible and it's within all our government regulations. So we might hope, for example, that later on we can do that, but we're unclear at the moment. It depends on what we're allowed to do.
Okay, I can see one of our attendees clicked raise hand. If you were trying to submit a question, just use the Q&A should be open, or you might also be able to use the chat as well. But definitely Q&A should be open if you want to type a question in there. So
Can I just add to
yes,
Eleanor's
yes.
thing? First of all, obviously, a lot of this is completely out with our control, not because we're trying to, because it comes from government regulation. But I would say both Eleanor and I, for other courses, have already run live Zoom lectures with the opportunity for interaction with the student. And my personal experience of running these lectures was entirely positive. And we've run tutorials, and again, I thought they were positive. I think there are ups and downs, whether attendees wish to turn on their screen to be visible and things like that is entirely personal choice. But there's but overall, we've been doing it. We're not completely going to start on the start date and say, oh, well, let's have a go now. We've been essentially dry running this, and it seems to work okay. It's not perfect. Of course, we'd rather be in the room with you guys and share stuff, but that may not be possible. So we'll see.
Dilys, do you want to comment on labs? That was part of the initial question.
I run one in the lab course. So basically what the government restriction that is influencing what we do face-to-face is the requirement for 2 meters social distancing. So for face-to-face lectures, that means that lecture rooms can only be run at 20% occupancy. So if you had 20 students, they have to be in a lecture hall for 100. So the difficulty is us finding rooms with appropriate social distancing, and even if that were the case, not necessarily all students are going to be comfortable in that environment. So what the university is saying at the moment, while we're under the 2 meter distancing, we will do all things online. However, because the university recognises that practical lab skills is something that students are very keen on learning, then we have sorted out our labs. It's been slightly difficult, but we're to run them with 2 meters distancing. Obviously labs are larger rooms, but what we're going to have to do is normally we would run lab classes with students in pairs. We can't run that. Students are going to have to run it individually. We've had to change some of our protocols because some equipment, for example, our weighing scales are communal and used by lots of people, so we can't use weighing scales. So we've changed some of our protocols so that students can do everything socially distanced. And we also have expanded the number of classes. So basically, for a practical class that we would run once, we're going to have to run it 4 times. Okay, so there will be an opportunity to do lab practical classes in a socially distanced manner, so it's COVID safe. However, we do recognise that there may be some students through travel restrictions or whatever who are not able to get physically into Glasgow in order to do those labs. So what we're going to do is there are online alternatives. Clearly they're not as good as doing it practically yourself, but there are online alternatives to do virtual laboratories. So what we're going to do is allow you to run through the methods that we're offering in a kind of virtual, it's like a computer game type environment. So at least you're mentally going through the steps of the protocol and everything. So there are basically, so the short answer is yes, practicals at the moment, unless there's any change in government guidance, at the moment with the 2 meter social distancing, they will be running and will be COVID safe. However, if for whatever reason, it might be that a student has pre-existing conditions and can't attend the class, or even if they're in Glasgow, or it might be they can't get into the country because of travel restrictions, then there will be alternatives. Okay.
Perfect. Thank you, Dilys. And I know that, do any of our academics need to run off back on 10 o'clock?
Well, I can run off at 11, but if there are any...
Sorry, 11.
11, yeah.
I know what time it is.
Any specific questions? Are there any that's come through in the chat for diabetes or anything I can...
I think the only other one that came in, which was, no, I think you answered it, because the other one that I had in mind was there was a student who said, in case they miss practical classes, is there a way to catch up? And I think that you've covered that with the fact that we have multiple options in place to try and run socially distanced labs, but there are also online backups, as it were.
Yeah.
Sorry, did you want to add anything
I would reiterate what Paddy says is I've certainly been running an undergraduate intercalated course since the 21st of September. We've been doing it all online and the students have really engaged in it. We've been doing little presentations. You can have tutorials online. We run it through Zoom, we run it through Teams, and it seems to be working okay, and they seem to be engaging, finding it okay, finding the workload okay, finding the access to the Zoom lectures. So a lot of the lectures we do live, and then they're recorded at the same time. Some lectures are pre-recorded. There's just kind of a mixture, and we're trying to mix up a bit so that you're not just spending all your time listening to people recorded online. You actually are getting opportunities to engage, chat with other students, do activities with other students, and to chat to the lecturers and teaching staff. So, you know, as far as it's worked as well as I could have imagined, is all I can say.
That's great. Thank you so much, Dilys. And if you need to pop off,
okay,
don't worry.
Great. Thanks very much. And if you've any diabetes students got any questions, you can just drop them to the diabetes email and we can answer it there. Okay?
Will do.
That's
Thank you.
great. Thanks very much.
Eleanor and Paddy, do you have a couple more minutes just to go over? I had a question here which was about research, which I thought might be quite interesting to cover. The question was generally, what does research look like in a cardiovascular sciences setting or in the field?
So I'll interest. So I just saw there's another question coming in at the same time on the chat about studying basic knowledge in advance, and I think Dilys is gone, but essentially it's relevant to both programs. Is that you definitely do advance your basic knowledge. I think what we've not touched on is clearly we've got lots of attendees, but lots of attendees come from completely different backgrounds, and I don't want to go into deep, but some happen to have an undergraduate degree in a science that's highly super relevant to the topic or a specific module. Others may have a more broad undergraduate degree. Some will be from medical or paramedical, nursing, pharmacy backgrounds. At every level, the notion is that you expand your knowledge, but clearly expanding that knowledge will be different based on where your background is. So it's difficult to give an answer to that. It kind of feeds into the second thing about talking about the research projects. At the end of the best bit for me of the course has always been the summer project, which is about 8 to 10 weeks, and essentially is a small project which usually has been of the order of analysing some data combined with doing some experiments and or analysing some clinical data, imaging data, that sort of stuff. This year it was a bit different because clearly at fairly short notice we had to change it into something else, but lots of our students still managed to analyse something original. And you know, data can be in lots of forms. And the idea would be that you work as if you're trying to produce a scientific paper. Over the years, some of the work has become scientific papers, others, and that really depends a bit on the project and the motivation of the student and the direction of things and luck. But it is what we aim to do is for students who wish to do so, produce some original data. And I still think even in the confines, even if next year we're still in this awful disaster of the world, and I think we're all in this together, we would still hope that people work on something original that is then suitable, that they can be proud of as a standalone bit of science and take it to the level that they want to do so. So I think that's what's reanalyzing some imaging data is still doable online. Clearly some stuff in the lab will require some work around the social distancing, and that we'll just have to wait and see. You can clearly meta-analyze existing trial data, but you putting your own new analyses on them, that type of stuff can all be done. Okay, Eleanor, I don't know if you want to comment further.
No, I completely agree. I think we've managed well this year. For example, the student working with me got a project analysing, you know, circulating microRNAs in patient populations to try and develop sort of new diagnostic tools and look at systems and pathways that may be involved in the pathogenesis of hypertension. And the students have looked at that data, analysed it, and gotten some nice results that hopefully will go towards maybe a scientific paper or something like that. So we've managed to adapt the projects accordingly, and you're still able to do some original research. We usually let the students choose what subject area they want to work on. We usually let them decide if they want to do a dissertation style project, a data analysis type project, and when we can offer it, a lab-based project. And every student's different, they want to do different things, and we try and accommodate that. We just have to see where we were. If we can offer you a lab project, we will try, but again, it's dependent on regulations, and we'll try and give you the best alternative possible, but something that's really in your area of interest.
Yeah, thank you. I feel like even just listening to you guys talking about supporting students through projects is making me think about what the answer might be for this coming up question, which was about formal support networks in the department, in the graduate school, mentoring opportunities. I think it sounds like obviously you guys do work really closely with anyone who's on your program, but would you have anything else to add to that question about mentoring or formal support?
So I think as students, you will go through the course, and there will be areas of interest or lecturers who you're particularly interested in their subject area. And all the staff on the course are available for you to go and chat with if you're interested in the research and you want to go and talk to them in more detail. Then we would encourage you to do so. And many of our students on our courses have done this and ended up doing, further higher degrees with people in the institute and also with, in other institutes. So there is, a system whereby we can try and pair you up with other people of interest. If you are experiencing other types of problems, and we'd go through this in the induction day, we would expect you to come and speak to, Lindsay, myself, or Paddy, and discuss if you're having any problems, or if you need help and support with anything, you need us to point you in the right direction of you might want a degree in, or you might want to pursue something in publishing or, another area of science. If you come and speak to us, we'll try and point you in the right direction and put you in touch with the correct people where possible. And I think in the past, many of our students have gone on to do a range of different things using those processes. Paddy, do you want to say anything more? Paddy looks like he's frozen.
He's doing a very good job of pretending if he's not. Oh no, right, maybe we've lost Paddy for a second. We'll give him a minute. We had one more question, which was about GUCVS. Is that the society? I'm assuming, I'm showing my ignorance here.
So what does it say?
GUCVS?
Glasgow University Cardiovascular Sciences. Is that?
Oh, is this perhaps a question from a diabetes student? Just to clarify, we've joined these two together because they have I think you have a few courses that can sometimes overlap, but we were just trying to do it on an institute basis so that you get to meet a few different people. If you're sitting here and you're on diabetes, but you're watching cardiovascular sciences, please don't be alarmed. We've just popped it together to kind of make it a bit more of a, have more people involved, more offer holders involved, get some more varied questions in there. If that hasn't, oh no, there is a society. I'm showing my ignorance. Did you know there was a society, Glasgow Uni Cardiovascular Society? No.
No.
Right, well, we'll have to look into that one and get back to you.
I was unaware. I think the issue with these societies is there's loads of
virus research, for example. So
maybe.
Yeah. The issue is, of course, there's so many. As with any massive university, and it could be anywhere there are often lots and lots of societies with their own individual websites, which may or may not be suitable. I mean, I haven't heard of that individual one, but in my other hats, there are medical student societies for people studying things, and there's endless, and quite often self-motivated students in lots and lots of faculties or departments will set up their own societies, and I struggle to negotiate through all of these. But that's the same for us, Edinburgh, King's, Cambridge, whatever, you know, so I confess I'm not aware of that one.
Certainly within cardiovascular sciences, within our institute, we do run, you know, programs of external speakers. That's difficult at the moment, but they're all online, of very, you know, very eminent people in the field of cardiovascular medicine and science. And students are perfectly welcome to join these seminars, and we would encourage that. So those are available, as they're not examined or part of the course, but they're an added bonus that you can sit in and listen to them. And, you know, there are also each week research in progress meetings by all the PhD students and the junior postdocs in the institute. And again, students are you know, can attend these. It gives people an idea of the research that's going on in the institute and everybody's area of interest. And, you know, students can pursue one of those if they see fit.
Right, we've had quite a few questions come in a bit last minute because we are going to need to finish up very soon. We've gone a few minutes over already. As a quick sort of overall answer to this one, we've had one about choosing optional subjects or interested in optional courses, but it's overlapping with core courses. That shouldn't happen, should it? A core course wouldn't run at the same time as an optional, or am I again?
No, it's
saying the wrong thing.
No, not all teaching's been finalised yet, so there shouldn't be any clashing.
Right.
No, there shouldn't be any clashing with obviously core courses and option courses. Yeah.
Basically, if you're having an issue, definitely email Lindsay.
All teaching still to be finalised as well.
Sorry, were you going to say something there, Eleanor? And
No, I just was about to say that I have had a couple of emails from people who are trying to access or log into particular options and they can't because it's clashing, so we need to fix that at our end. And I think the timetable, the fine-tuning is still being done. They won't overlap.
Yeah, okay. I think unfortunately that is a technical issue which has come because we've moved everything 2 months back and we haven't quite fixed everything yet. But if you are having worries about that, please do contact us. And finally, we had a question about numbers. I don't know off the top of my head how many we've got for diabetes. I did have that written down somewhere, but will there be a platform to connect us before the course starts? I'm thinking maybe there's going to be a Moodle page that's going to be like an induction, isn't there? And that might be a good way to get to meet other people.
For cardiovascular sciences and also for diabetes, there will be an induction day. So we will meet up with all the students who are registered in each course, that's for sure. And we'll go through things like the course structure, options, things like that. There will also be a Moodle page, as you've just said, and that's an area where people can connect to everybody in the course. And, you know, lots of the students set up groups in their own to discuss things with each other, but there will be a Moodle page for each programme, yes.
Okay, right, I think we'd better wind things up there for now, but have you got anything else that you'd like to add?
I've kind of run out of time, unfortunately.
No, that's fine. And in that case, we'll end it there, but any questions, give us a shout. Thank you so much for joining us again as well. And thank you also to our academics for joining us. And I'm sure I can maybe speak for you if I say that we're really looking forward to welcoming you, whether that be in person, on a screen, whatever format that takes. We're really looking forward to having you here. And we are here for you if you've got questions or anything like that.
Okay.
All right. Thank you very much, everyone.
Bye. Bye.
Bye for now.